Good afternoon, everyone. Thank you for joining us today for this exciting webinar, Enhancing Patient Experience Through Personalized Care. So, we'll start by welcoming our speakers and then we'll talk about major challenges like outdated systems and patient care issues in the healthcare. And then we'll learn how the software can simplify healthcare operations and improve the patient care. And then we'll show the real examples, like real use cases, how technology is solving these challenges in the healthcare. So feel free to use the Q&A section throughout the webinar to share your thoughts, or maybe if you have any questions. And we will ensure that they are addressed in the interactive Q&A session towards the end. So let's get started. Before we dive in, let's take a moment to reflect on why we are here. So the healthcare industry is rapidly evolving, and the technology is playing an increasingly critical role in shaping patient care and organizational efficiency. So today's session, we will explore how the software can address the challenges and create the transformative opportunities. So these are the few takeaways you can expect from today's webinar, like understanding the critical role of technology in modern healthcare, identifying the key challenges and opportunities in the healthcare, and benefits of unified healthcare software, enhancing patient care with the technology. So by the end of today's session, you will have a clear vision on how to address these challenges and seize the new opportunities in your healthcare journey. So before we get started, let me introduce two our amazing speakers who will be sharing their knowledge with us today. So we have Karthik Manikyam, Partnership Marketing Manager at Johor Corporation. And we have Raghu Patri, Chief Revenue Officer at Hita Partners. And we have Mangalampalli and Narsimhamurthy Garu, a specialist in the healthcare, pharma, and biomedical industries. With years of experience in these fields, Murthy will share how technology can make a big difference in the healthcare. And now let's give a warm welcome to our esteemed speaker, Murthy Garu, as we invite him to share his invaluable insights on how technology can transform the healthcare sector. Murthy Garu.
Good afternoon to all the participants for this webinar. And basically, as you have been briefed about the technology advancement, and right now, currently in India, we have major challenges which most of you healthcare practitioners who have been practicing will also agree with me. Like the challenges faced by the Indian healthcare system is basically into three categories of affordability, accessibility, and care management. And in terms of rapid growth, in terms of medical advancement as well as developing technology, but medical facilities were still not reached to the common man. Primarily, if you look at the patient perspective, patients lost the follow because once they have been diagnosed with a healthcare professional and been asked to make the follow because of various reasons, they are not in a position to reach out because of various factors, which can be of cost effectiveness, could be the high cost of the treatment, or and there is no proper follow-up and the outcomes are poor. Thereby, the patients are moving from one place to other place and having a different kind of data, different kind of approach, which has no uniformity in the treatment and diagnosis. So this need to be addressed on the priorities. The outcomes need to be managed as the elderly population, especially you can see that 41% of elderly population is facing with one or other chronic diseases like cardiovascular, metabolic disorders, cancer, and other areas. But this technology will definitely to bring down all these things and see that ensure the patient is retained with the same healthcare professional to have a better outcomes. So, in nutshell, there are many other things like where you have the government policies and you have a private sectors as well as and government sectors in terms of medical management, and we find still we are far below in the developed countries, or we are talking about the developed countries. So with this, I think whatever the next few slides which we are going to help you out to provide a solution for the unmet needs, I request Mr. Karthikeyan and Raghu Garu to take care of the further proceedings of the program to help out to bring down the complexities of the outcomes of the patient. Yeah. Hello. Hello.
Right. Thank you,
Yeah.
Murthy garu.
Yeah.
That was very insightful.
Yeah.
I request Karthik to take over at this point and then speak a little about Zoho and how it can help before I come on to the next session. Karthik has built a very trusted platform across the years. Leveraging that same trust and the scalability, I would like to see how we can address specific concerns that are there in the healthcare industry, and then we will see how Zoho's platform can work to help overcome these challenges. Next slide, Teja. Move on. Right. So we spoke about how Zoho can help in the healthcare sector. So Zoho's suite of cloud-based applications, we spoke about 55 plus applications which are available. So all these are interoperable, follow the standard consistent interface across. So the ability to see and the visibility of data across these is very, very seamless. So this provides a very flexible and scalable solution to ensure that especially in the healthcare industry where we have fragmented information spread across multiple silos. So Zoho software typically helps to bring everything together, unify it, to ensure that there is no disparity in anyone viewing the information at any given point in time, right? So the areas that we can specifically look at, it's like optimizing patient care, for example, right? When we talk about how we manage a patient relationship, how do we manage their appointment scheduling, they take care of, for example, even telehealth integration. In many cases, we might need to find that, senior citizens or a set of patients with specific problems may not always be able to, come down to a clinic or a hospital for their evaluations. And so on the fly, the ability to have a telehealth integration is available with Zoho. Similarly, we ensure that the operations in-house get streamlined completely. You can the entire workflow can be automated. You can manage the documents across and ensure that the right people get to see the right kind of documents. Team collaboration and communication happens seamlessly in-house on that. And to ensure that we have a steady flow, we have good marketing tools and which help in ensuring that, if we can run the right kind of campaigns and target the marketing in specific, sectors. So the patients will be made aware, and then that is where we can use that to, attract patients as we start working on these particular campaigns. And finally, of course, enhancing the financial management. This is always a tricky scenario where patient has to make multiple payments across multiple different services that are being provided by the hospital. And Zoho ensures that everything gets unified into one place. Internally, how it is dispersed can be a workflow which can be taken care of, but for the patient, it becomes a very single window kind of a session where he just has to make a payment and then everything gets kind of integrated. We will see some of this as we do the demo of the product that we talked about. Move on to the next slide, Teja. So let's look at some of the challenges that we face in the healthcare systems. So 3 areas that we will talk about today is one is fragmented data. So this is the challenge that we are seeing across clinics and hospitals, not just in the recent past, but over the years. And this is a challenge that comes up because most clinics and hospitals tend to work with different solutions which cater to specific needs. Now, with Zoho's unified software, this becomes redundant because everything is available under one platform, right? And this ensures that there's no communication gap, between the patients, doctors, and the administrative staff. See, typically when we look at a hospital or a clinic, where they're all siloed, right? I mean, the administrative staff doesn't get to interact with the patients, whereas the front office staff gets to interact with the patients, but they don't get to interact with the doctors. The doctors probably interact with the administrative staff and patients, but don't interact with uh, the front office staff. So here there's a disparity. To ensure that there is seamless communication, it becomes easy where you have a single tool which can ensure that communication flows to the right. You can set up the rules, you can set up the way you want to, ensure the communication flows, and everybody will have access to the right kind of, information at any given time. And of course, the challenge that we face is compliance and security in handling sensitive patient information, and the ability for an organization to, let us say, do a follow-up to ensure that the patient is able to come back and then follow up on his routine checkups. And so all these can be now easily taken care of through the single tool that we have on Zoho. Next slide, Teja. So as we spoke about it, the Zoho's unified tool, which talks about the first thing that we look at is the patient record management. Now here, all the patient information is stored in a very secure manner. We spoke about how data centers are very secure, and that's one of the first and foremost thing that comes into the picture. So any information that a patient stores on a Zoho platform is absolutely secured, and there is no chance of it being misused there on that. These, of course, there are compliances that are there. Like, for example, in the US, you have HIPAA laws, which ensure, which talk about how patient data could be secured. Zoho complies with that. And of course, in India also, laws are coming into being, and this is likely to happen in the near future, on how patient records should be stored. And as those laws evolve and as they get standardized, the Zoho platform will ensure that the compliance is there to take care of all that, right? One of the challenges that we see is how do we talk to patients and then understand when is it. The challenge we have is that someone books an appointment but then tends to forget about it, right? And it's a challenge to keep reminding them. Multiple phone calls have to go through, and these are very ineffective methods by which people can talk about how reminders can be done. This process can be automated by using Zoho tools, right? So you can set up a rule and say, hey, your appointment is in about 3 days time, so that that a message goes which talks about your appointment is coming up in 3 days, and you need to do this kind of preparations. In case there's any prep that they have to do for the upcoming appointment, then those can be sent as reminders to ensure that the patient complies with all of them. And this can be scheduled based upon it. You can do one per day, maybe one, and then on the day of the appointment, you can do maybe multiple such message follow-ups to ensure that the patient does not forget or doesn't miss the appointment. And this, of course, not only for the pre, but also post-appointment. Then we talk about how we can share information in a manner which is convenient to them, because there could be post, follow-up things that need to be done, which normally the doctor would recommend at the time of diagnosis, but patients tend to forget. So that can be automatically put into the system, and these reminders, along with additional information, all of them can be sent across to them to ensure that they follow the procedures, and it helps with their wellness. Next slide, Teja. So let's take a quick look at how Zoho's platform can be used to optimize, healthcare outcomes on that. I spoke about these in general, but these are the specific tools that can be used within Zoho itself, right? For example, mail. Mail is a very common communication mechanism, and Zoho Mail is very, very effective in ensuring that that we can send out the right reminders, send out the right information at the right time on that. Zoho Books ensures that billing and payments are taken care of seamlessly. Like I said, we'll have a one point access at the POS counter or at the reception where the patient makes the payment, and this information is stored and then dissipated internally based upon rules that have been set up to ensure that the pharmacy gets its right revenue tracked, the outpatient department gets the right revenue tracked, or the OT gets the right revenue tracked. So everything is taken care of internally there on that. From a patient's perspective, they can use Zoho bookings to ensure that the appointments are scheduled properly. This is a very simple process. So all the patient needs to do is maybe go onto the hospital website and choose a slot and say, hey, I want to be on this day at this thing. The doctor, it gets booked. And this information is then passed on internally to all the required resources so that everybody is aware of the appointments as they come through on that. Zoho meetings can be used for remote, telehealth if necessary. And this can be, like I said, set up on the fly. So it need not happen that, one has to wait for a certain, kind of, it can be just done at a moment's notice and automatically scheduled and set up so that the doctors can ensure that the patient sometimes needs to sit at home and then get his or her information across. And this can be done very, very easily. The CRM is used typically to ensure that the entire patient history is stored, and any follow-up, any kind of information that needs to be shared, or any schedule that has to be created, or any follow-up appointment that has to be created, everything can be ruled into the CRM, and then the CRM will help automate and then keep track of all the information. So what happens is on subsequent visits, all the information from the past records is available with the doctor, with the patient. So everything is made available seamlessly, and then they can just use this platform to ensure that they don't have to worry about all these minor nuances, and they just focus on the healthcare aspects or the wellness aspects that are required by the doctor. And of course, we have Zoho Click, which is an internal communication tool. So if anyone needs to talk internally between the parties, then it's available for conversations. And these conversations can be across departments, so that ensuring that everybody who's connected can use this tool for communication. Zoho Forms is a means by which we can capture the information. I mean, in case a patient is booking an appointment and would like to share some information in advance, then we can create customized forms which ensures that we capture this information so that this information is preloaded to the doctor before the patient actually visits, and they get a clear picture about what is happening in the patient even before the patient walks into the room. And of course, Zoho Desk is there to take care of all the remote patient monitoring. That is post the whole scenario of a visit. Any information that needs to be passed on for a follow-up visit, for a follow-up on the patient on certain aspects, or sharing wellness tips. All this can be done through the Zoho Desk. And of course, the inventory is a module which ensures that it keeps track of all the resources that are required for the doctors and for the clinic, and in terms of all their equipment, and everything is made available under a single room. So a combination of all these, customized to the requirements of most clinics and hospitals, will ensure that seamless interaction for patients, doctors, administrative staff across the platform. Next slide, Teja. So let's talk about some simple use cases so that you get an idea about how these can be done. So let's take an initial thing from a patient's perspective, right? So how does the patient actually come in and book an appointment? Like I said, there are two things. We can use Zoho bookings to ensure that they pick a slot. Like, for example, in case of a doctor, we can have separate calendars for separate doctors, right? Every doctor gets a separate calendar schedule so that there's no clash with anybody else. And when you have a booking form, which is made available on the website, the patient can go and choose the doctor maybe by specialization or by name, depending on how they would like to identify the doctor. And once they find the appropriate doctor, they can look at the slots which are made. And these can be prefixed. Let's say a doctor comes and visits the hospital between 3 p.m. to 7 p.m. Then we can only open up those slots. And let's assume he comes only on Monday, Wednesday, and Friday. Only those slots can be made available. And based upon that, the patient can go back and say, hey, this is the availability of the slots, and let me book this one. And when they book it, that slot gets blocked for them. And this information is then passed on. Along with the booking, depending on the way the patient, or depending on the kind of specialty of the doctor, or depending on the kind of need, forms can be created to ensure that any additional information that is required from the patient before they come for the visit is captured using that form. So you'll have a Zoho bookings which will ensure that the booking happens, and a form which will ensure that it captures the information about the patient before they check in. And this information is then fed directly into the CRM, which ensures that this information is passed on to all the different departments so that everybody is on the same page. The doctor is aware of the number of appointments, administrative staff knows who all are coming at what time, and the clinic, in case they need to prepare for it in terms of saying that we need some additional medications, equipment, based on the inputs given by the patient, they can ensure that they stock everything available. So this is one use case where we talk about how Zoho's tool can help streamline a process. Let's move on to the next one. The next use case is how do we reduce administrative burdens, right? So we've seen data that comes in from a patient and lands up onto the CRM, right? So once the patient comes in and then starts, gets his diagnosis done, then this CRM can ensure that the further flow that happens from there is taken care of. So it will pass on this information to Zoho Book saying that, hey, you know what, this guy has booked this particular appointment and this is how much he has to get billed. And he has gone to the pharmacy, he's purchased these medicines, then the medicines cost this amount, and this information is then billed, and the whole thing goes into Zoho Books. And by the time the patient comes out to check out, the Zoho Payments link will be created and it'll just capture the total amount that is to be done by the patient on that. So simple, straightforward flow, ensuring that the whole process is seamless. Right from the time the patient just walks out of the hospital, the room from where he has met the doctor, right to the time he checks out. It's a very simple, straightforward flow there. And the next use case we'll see is what happens after the patient goes back home, right? So again, all this information on the payments, on the billing, everything is captured in the CRM. So the CRM becomes your fulcrum, for the entire trigger to happen. And based on the kind of treatment given by the doctor, he can trigger and say, hey, you know what, after 7 days, he needs to do X, Y, Z. And after 10 days, he needs to do ABC. And after 15 days, he has to come back and visit me. All this information from the CRM will then go on to the Zoho desk, where a person can pass on these messages. You can automate it and then set up reminders for the patient and say, oh, you know what, on 7th day you have to do this. So from the 5th day onwards, they send out messages, 2 more days for you to do this, 1 more day to do this, till such time that they do that. Similarly, then you can automatically, get a confirmation about the next appointment. Doctor says he wants to see you in 15 days time. So when is the convenient slot? And then send out the link for them to be able to do it, or ask them to book it up, or maybe just call them and then take the confirmation and then, book. So all this can be done using the Zoho desk, and this becomes a seamless process, ensuring that the post-care continues for the doctors and the patient as well. So these are 3 simple use cases that we have seen, but these are the challenges which are faced in most clinics and hospitals. Shall we move on, Teja? So given a simple process flow of how patients work, right, we'll just walk through how this can be done as a process, right? So on the left side, if you see, these are the various departments or the kind of people involved in a whole process. You have a patient, you have clinical staff, you have a doctor, you have a pharmacy, and you have the accounts department, right? So let's say the patient comes, and then typically maybe through a website, he'll create his profile online, and then he'll request for an appointment, right? So once that appointment gets requested, then the clinic staff will look at it and say, hey, this particular patient is asking for this, doctor is available. They'll probably send a confirmation. Yes, your appointment is booked. On the day, the person comes, does his complete, health screening and all that, and then comes into the clinic, and the clinic staff will then check him in and then ensure that he's logged into the system as that he has come for the appointment. And then the doctor will do the diagnosis. So till then, the doctor doesn't come into the picture, and it's just that this is done by the clinic staff so far. So once the doctor takes over, he'll do his diagnosis and then set up the thing and say, hey, these are the things that you need to do, and here is your prescription. Please get these medications, and then you can move on that. So after this, once this person finishes his diagnosis and then steps out, then the clinic staff will prepare an invoice for his diagnosis, and this person goes to the pharmacy and purchases the medicine. The pharmacy will then raise a invoice for the purchase of both of the medications. These entire invoices that are there will then move on to the patient out desk, where they will be checking out, where they make the payment. And once the payment is done, it is captured in the accounts, and then the patient is then checked out and he moves on that. This is a typical workflow that happens in any hospital, clinic, and all for outpatients. So the entire process, right from the time he looks at the appointment to the time he checks out, is all possible through Zoho as a unified platform, with no need to go on to any other tool to get your information. Everything is made available seamlessly right through the single interface. Next slide, Teja. From a hospital perspective, it's a simple, unified, singular software with dashboards available like this, where you can keep track of what's happening. And these dashboards are customizable depending on the department, depending on the kind of person who's seeing it. And they can say, hey, these are the things that I need to track on a regular basis. They're made available on my dashboard. And I can see today what is happening, what I need to do in the next 10 minutes, in the next 1 hour, in the next 5 hours, in the next 1 day. Everything can be put as per the requirements. And this can be customized role-wise, user-wise, to ensure that everybody gets the right kind of information the way they want to see it. So this is about the Zoho's unified tool. And I've tried to cover up most of the aspects. And we'd be happy to, take question answers. And if anyone's interested, we would be happy to do a one-on-one demo at a later stage, where we can actually talk about, what all are required to ensure that, a seamless process is taken through there. Right. Thanks, everyone. I appreciate your patience in listening to all of us. And we look forward to any question answers on this.
Thank you, Raghu. I think that was a whole host of insights which should have been useful to a lot of attendees. So let's wait for more Q&A. Even if it is a simple question, I think that's fine. I think as long as we don't ask.
Okay, I haven't seen any question answers. In case there are any, we'll be happy to address. But if not, if anyone would like to have a little more information about this, Teja, can we move on to the next slide? We'll be happy if you guys can connect with us. And that's our contact number. You can either call us or WhatsApp us, alternately go on to our website, or you can send us a mail and book. We'll be happy to either you can book an appointment where we can talk to you or demo what we have. And we look forward to, interacting with you on this. Right. So thanks, everyone. Real pleasure having you all here. And we look forward to our continued interaction on this.
Okay. Somebody has raised their hands. Melvin had raised his hands. Hi, Melvin.
Right. If there's nothing else, then we will end the session. Right. Thanks, everyone. Thanks for your participation. Appreciate it.